Are you a crappy partner, crappy wife, crappy husband, crappy mate? This podcast is for you. Give yourself the gift of self-awareness. Learn new skills. Take the time to assess your partnership, marriage, relationship, etc. So how are we going to do this? Start by taking the Crappy Mate quiz. The quiz can be found on our website, www.crappymate.com, on Pinterest, Crappy Mate, Instagram and Facebook, Crappy Mate Podcast. We will dedicate episodes to discussing the quiz topics. In further episodes, we will be exploring common problems, speed bumps that occur in relationships. Also, we will introduce time-tested skills and helpful hints to enhance your relationship, and we invite you, our listeners, to contribute your thoughts, questions, or concerns regarding relationships. Welcome to the Crappy Mate Podcast. I'm Dr. Richard Vance Barnes, MD. I'm a board-certified general psychiatrist with 25 plus years in psychiatry. I have treated patients in a variety of settings, both inpatient units, outpatient units, partial hospitalization units, as well as detoxification programs and rehabilitation programs. And I've had a private practice for many, many years.
And I'm Barbara Quaid, a marriage and family therapist. I also have over 25 years experience working with families, individuals, and couples. And my life as a therapist has been both humbling and joyful. Before we get started, I'd just like to talk about our disclaimer. The Crappy Mate podcast is designed to be a useful tool to help individuals and couples have happier and healthier relationships. This podcast is not a substitute for individual or couples therapy, and as always, relationships need to be safe. Seek professional help as needed.
The Crappy Mate podcast was developed out of hearing years and years of stories and accounts from patients in therapy about their mates and themselves actually being crappy mates and poorly behaving within the relationship. And so this concept was then developed into a podcast of how can we help people to actually improve upon their relationships.
And so in order to do this, we developed a quiz. And the quiz, we really thought about some concepts that we thought were important in a relationship. And so the Crappy Mate quiz ended up being a 10-question self-scoring assessment that can be found on our Facebook page. And our Facebook page is aptly named the Crappy Mate Podcast. And along with the quiz, you will find a glossary with the terms we used both in the podcast and on the quiz. And this is so we can all be on the same page. Now, to score the quiz, you will read each question carefully and then ask yourself, do I do this almost always, sometimes, or almost never? And when we thought about this, the scoring is like this. Almost always is worth 3 points, sometimes 2 points, and almost never 1 point. So once you have your total points, you add them up. And a score of 10 to 17 clearly indicates that one needs improvement. A score of 17 to 24, one has a degree of awareness, but improvement can still be beneficial. And a score of 24 to 30, one is aware, insightful, and acting in a positive manner as it pertains to the relationship. Welcome to the Crappy Mate podcast. In today's episode, we will be talking about relationships following the death of a child. This topic has been coming up for us both professionally and personally, and we thought we'd pivot from some of our other episodes in order to address the dynamic of what happens in a relationship following the death of a child. And of course, the death of a child has so much impact on a relationship that this is something that we need to talk about, but most people don't want to talk about. So we thought we'd address it in these episodes. So Dr. B, what are some ways that we can lose a child?
Well, sadly, Barbara, there are a number of ways that we can lose a child. And one of the ways that has been noted to occur at an increased rate these days is by way of suicide. There's also death by murder. There's death following a long-term illness. And there's also death by way of accidents, and in particular, motor vehicle accidents. There's death by way of a miscarriage. And there's also sudden medical or surgical complications that lead to death as well.
And unfortunately, there's some terrible statistics surrounding death of children. And in the United States, motor vehicle accidents used to be the highest, number one cause of death in children. Unfortunately, that's been now replaced since 2020 with firearms. So firearms are the number one cause of death for children. And with suicide, it's the third cause of death for children ages 10 to 14. And that's information from the National Institute of Mental Health. And even a sadder case is that it's the 10th cause of death for elementary school children. Now, that would be 11 or 10 and under. Boys tend to complete more than girls, but girls are quickly catching up with that statistic, unfortunately. Now, with little children, drowning is the leading cause of death for children ages 1 through 4. So, with all of these, there's just so many things to unpack here and so many things that happen following the death of a child.
And what I see most often in my patients is that there are changes that occur in just the communication style between the couple. And there's decreases also in intimacy, both physical and emotional intimacy. Trust seems to be another area in which couples will have difficulties in maintaining after the death of a child. There's also difficulties in just expressing feelings. And there's often an increase in health problems that we see in individuals after losing their child by way of death. And from an occupational standpoint, there's a decrease usually in the effectiveness and the ability to perform at work. Even though people may be at work, they may not have missed many days of work following the loss of their child. But when they're there, it seems that their effectiveness has been diminished by the death of their child, and maybe their focus and their concentration may be altered greatly after they've lost a child.
You know, Dr. B, what I see, and this is just what I have seen over the years, is that grieving is such a lonely process, and all of us do it differently. And in a couple, people will look at the other person and think, oh, they're not grieving enough, or grieving too much. They're not taking care of normal everyday life tasks, but it's so individual. And I think in a couple, this becomes an issue, wouldn't you say?
Yes, I would agree with that. And one of the other aspects that seems to point this out, the differences within a couple, is the whole notion that people socialize less, and they may not be at all inclined to socialize, not only with friends, but also with family as well. So that's something that we'll see, and there'll be a difference in terms of how members of the couple, of the partnership, the marriage, the relationship, how they differ in terms of their ability to socialize and to be with other people. To me, it's an indication also that their grieving process is quite different. And it is for each and every one of us. It's going to be different.
And I would say there's no wrong way to grieve. Grieving is grieving.
No, there is not a wrong way. And honestly, I'm not quite sure if there's truly a right way for every individual. And I think that we have to make note of that. And we have to be careful with the fact that we're watching people and they're grieving, but they're grieving in their own style, in their own way. And it may not be what we would expect people to grieve with or how they should grieve. And so let me talk about a case, and this is just going to be a composite because we really want to protect the patients that we are working with currently that have lost children, but also the people in the past that we've worked with. We want to protect those people as well. So as we talk about these cases, they're going to be composites. They're not actual cases, but they contain much of the same information regarding how people grieve and the behavioral changes that we would see as people have lost a child. So this first case is the death of a child following a long-term illness, and this child was ill from really day one. And within the hospital setting, it was quite dramatic because there was a lot of staff that was always around this child and always working closely with this child. And both mom and dad also participated greatly in the care of this child, both in the hospital and certainly when the child was eventually released to be able to come home. Their home was very much like a hospital ward where they had a hospital bed and they had hospital equipment. And they even had personnel, like a nurse, that would stay over sometimes 24 hours to care for the child. And so both parents had really dedicated their lives to taking care of this child. And it seems like with the loss of this child, both parents had lost purpose. And it seemed like they had lost purpose for their life, for their routines, for how they were conducting themselves. And let me talk about Dad in specific. Dad particularly was rather withdrawn in this situation. And he had a decrease clearly in his energy levels and his zest for life. He, in fact, though, found himself to be working more. And I think this was his cover, and this was his way to deal with his grief, and to not be home where his child had passed and where his home had been set up as almost like a hospital ward or a hospital room. So I think Dad was really trying to escape some of these memories and deal with his grief by working much more excessively. Now, the thing that we found in this case is that Dad, even though he was working more, he was not quite as effective. And in fact, he found himself really making many more errors at work. And he found that his focus and his concentration really was disturbed.
And when you look at this case, everything has changed. So not only is there the loss of the child and that huge void, but probably within days, all that medical equipment was returned to a hospital or someplace else. All those people that came in to help were gone. And so suddenly there's this huge, huge void. And both parents are probably just suffering from lack of purpose.
Mm-hmm. Now, as we look at Mom had quit her job many years ago when the child was really an infant and dedicated herself really to being almost like an overseer of the medical unit that they had at their house, with nurses coming and going in their shifts, as well as their equipment and making sure the equipment was functional. So when the child had passed, Mom really lost touch with most of her friends and even family. But Mom found herself really at a loss to function on a daily basis, and she found herself continuously crying throughout the entire day.
And how about her immune system? So in this case, I think you said she had some health issues.
Yes, and Mom in this case had suffered from lupus and found that there were many more problems and painful events that she was happening as she had lost her child. And this is a key finding that we see quite often, Barbara, where people that have suffered this form of grief and this form of loss will suddenly have more health issues. And if they were inflicted with some chronic concerns, they will now have more of these health issues come to the forefront.
And I think that's for a couple of reasons. One, they probably were not considering their own health during this whole time that they're caring for their child. But also, it seems like our bodies are telling us, keep going, keep going, keep going. And then after the child has died, there's just your body is saying, okay, now I can get sick.
It would almost seem to be that situation. I think it's probably more, and this is theoretical, obviously, but to me, it seems to be more of an immune functioning whereby the cortisol levels the stress hormone stays so high, and then that decreases the functionality of our immune system and the circulating white blood cells. And so there is an impact on our immune functioning and our immune system. And clearly, as we stay under stress, we are not as able to fight off things, clearly.
So this family had a lot of things going on for them, and then some probably difficulty communicating and intimacy, all of these issues. Is that correct?
Yes, that was definitely the situation in this case, because it was almost as if both mom and dad were separated, even though they were living in the same house, but they were going through a different style of grieving, and they were experiencing different feelings that they were not sharing with one another, which is something that we'll see quite often in couples as they have lost a child. And perhaps there is some of the blame game that may be going on. There may be some trust issues, as we talked about. But it could be that quite often they're at different levels in different styles of grieving, and they're not matching up, and they're not communicating about the differences in the way they're feeling.
I have another hypothetical case for all of you and for our listeners, and this would be an accidental death. So it's a really sad occurrence that motor vehicle accidents rank really high statistically for the death of children. And in this situation, this was a motor vehicle accident, but neither parent at this point was at fault in this motor crash. However, both of these parents are very, very angry. They are experiencing anger at the other driver. They're experiencing anger at maybe transportation or the signage in the city, but they're really looking for a root cause. They want to be angry, and they want to know why this happened. And of course, most likely they'll never know why and what happened exactly. So in this case, Dad has started drinking more. He used to be a social drinker. And suddenly he's coming home. First thing he does is he goes to the hard alcohol. He's drinking all night. He's withdrawn. And he doesn't want to talk about his child. He doesn't even want to mention his child's name. He also isn't sleeping. He's not eating. And he's losing himself to the internet, either with video games or porn or who knows what. Now, Mom, on the other hand, had been in the past prescribed Xanax, but she's overusing it now. She's using it daily, sometimes many times a day. And she's having trouble attending to her other children. She just seems to have lost this will, this happiness about life and her children. Her children have been late for school and sometimes sent in dirty clothing and without lunch money. So in this case, clearly both parents are using some kind of substance in order, what they believe is to cope with the death of their child. However, I'm just going to say that when you mask it like that, when you mask your grief with alcohol or drugs or porn or any of these, some other kind of substance, you're not really avoiding the grief. You're just delaying it. Would you agree with that, Dr. B?
I would agree with that 100%, Barbara. And I think that that's something that I try to really caution my patients against, and that is trying to use these buffers. And they're really emotional buffers, right? Alcohol and pills at times. It can be even overeating. It could be avoidance by way of playing video games or being involved in pornography sessions. Whatever these covers and these buffers are, they're delaying the inevitable in terms of the pain that people are feeling and also dealing with the grief head on. And so for my patients, I tell them that you're just going to experience more of these awful feelings of loss for a further period of time if you are using these artificial buffers that help you to cope with your emotions on an immediate basis.
So thank you for that. And I just wanted to point out that I think for our listeners, this has probably been a difficult topic. And I will just say personally, we had a difficult time even talking about it ourselves, and we deal with this daily, really. So just remember that you're not alone, and we will be offering some suggestions to help you to work through this or to help you in your grieving process and to help you maintain a better relationship. So I've got some helpful hints for you today. And helpful hint number 1 is accept help. And I know this is hard for people, but there are going to be people out there. There's going to be friends, neighbors, coworkers, family members, and even people that you didn't know that well who will come to help. Let them help you. Number 2, know that you are not alone. And what I'm going to say is that in most communities, there are groups or there are resources. Look for them, find out about them, and allow yourself to do the research. Number 3, allow yourself to grieve. And I think a lot of people don't want to grieve. They think that they're crying too much or something's wrong with them because they're crying so much, but allow yourself to grieve. That's a normal process. And number 4, focus on maintaining good, healthy habits. So be careful with drugs, alcohol, other ways that are masking your grief, and try to steer yourself towards healthier habits like eating well, sleeping well, exercising, and being social.
Well, thank you for that, Barbara. I think those helpful hints will help our listeners to begin the process and also to perhaps have a better understanding that they're really not alone in this process and that grief is quite individual, but there are some key things that we want to watch out for so that we can maintain our health, because I think ultimately our loved ones want us to do well with this.
Thank you.
In closing the podcast today, I just want to remind our listeners of our disclaimer. The Crappy Mate podcast is designed to be a useful tool to help individuals and couples have happier and healthier relationships. This podcast is not a substitute for individual or couples therapy. And as always, relationships need to be safe. Seek professional help as needed.
Thank you for listening to the Crappy Mate podcast. We invite you to submit comments, questions, and/or concerns about today's podcast, or give us feedback on relationship topics you'd like to hear covered. We encourage you to try our helpful hints. Give these a go, try them on for size. Remember, you can follow us on our Facebook and Instagram pages under the Crappy Mate podcast. Our website is www.crappymate.com. And please be sure to subscribe. Thank you for listening.